Hi, Spencer McCombs here, Doctor of Physical Therapy at McCombs & Associates Physical Therapy. I want to talk to you today about pain reprocessing therapy. This is an aspect of physical therapy where we treat in a way that may be a little bit counterintuitive, but it's an aspect of therapy that we incorporate into the physical treatments that tends to really help pain, not just to manage pain, but actually to help pain go away for good once and for all. So this is a very effective treatment that we started using about 10 years ago. I've been practicing for almost 20 years. And during the first 8 years of my practice, if a patient came in with limited range of motion or weakness or coordination issues, I would tend to just treat with hands-on therapy or with exercise or with balance exercises and just really addressing the underlying structural problem, focusing very little on the connection between the mind and the body. But I had an experience about 10 years ago where a patient of mine began to experience pain in her knee, and I began to treat the knee. It did not get better, and the pain began to spread to different areas of her body. It went from her knee up into her back, so now her back and her knee were hurting, and then went up into her upper back, into her neck and arms. And I continued to work with her and treat her, and the pain just did not improve. So this patient went to see different specialists here in the Lubbock area, and also different places in the U.S. trying to find some relief for her pain. She was young, she had many children. Well, she had 4 children, she was a busy mom, and the pain just persisted. And this persisted over a period of years. Well, thankfully, she stuck with me. And one day, a patient was laying on the table, not this patient, but a different one, and the patient asked a very specific question. He said, can stress cause pain? And I'd been taught in physical therapy school that pain can be aggravated by stress, but stress could never be the cause. There was always some underlying structural problem. So that was my response to this patient. And he said, well, I was just wondering because I'm reading this book that says that stress can cause pain. So I asked him about the book. It was written by a medical doctor by the name of Dr. John Sarno. And the book basically states that there is a mind-body connection, and then certain negative emotions such as stress can increase muscle tension, can cause nerve issues, and can cause all kinds of pain. So I brought this approach. I researched this doctor and his work and found out that there were many others that pursued this pain reprocessing therapy as well. And I presented it to my initial patient, and just after a very short period of time, she started running again. Her pain went away, and now it's been about 10 years, and after 6 years of really bad pain, for the last 10 years she's had very little to no pain and been basically cured of the horrible pain and dysfunction she was having. Her pain got so bad that she was spending most of her time laying in bed. But she had, like I said, a complete resolution of her pain and did very well. So over the last 10 years, I've incorporated this with my patients that tend to have more chronic pain, and they've done very, very well. So I want to explain to you how this works. How is it that certain emotions that we carry inside of our mind can turn into pain in our body? So I drew out here a circle, and this circle represents the brain. Now there's 2 parts to the brain. There's a conscious part, the part that we're aware of, that does our thinking and our reasoning and our voluntary actions. That's all coming from our conscious brain. The unconscious brain, which really is much larger than the conscious, it's responsible for everything happening in our body automatically. Things like our heart rate. We don't have to think about our heart beating. Our heart and our brain just do that. Or digestion. Thank goodness we don't have to push our food down through our esophagus and through our intestines. Our unconscious monitors and activates that automatically. Or blood pressure, or muscle tone. Muscle tone in our body, whether it's high muscle tone, like tight muscles, or low muscle tone, that's all monitored and controlled by the unconscious. Nerve function, the sleep-wake cycle. So these are all automatic processes. There's many more that the unconscious does automatically for us without us having to think about it. So let me show you how something stressful in our life can cause pain in our body. First, it's important. Body connects to the brain. So the brain will carry signals down the spinal cord to our body, and the brain will also receive signals from the body to the brain where it processes those signals. All right, so that's what those green arrows represent. So let's say something in life happens, like maybe something stressful happens. Maybe you lose a loved one, or maybe you get fired at your job, or maybe it's just the daily stress of being aggravated at work or by your children, or maybe there's some sadness. So something happens that creates a thought. So we're aware of that in our conscious. Let's say we lose a loved one, and the thought that we have is, I'm so sad about losing my loved one. What am I going to do with my life? Now, if that thought goes unexpressed or unaddressed, or we try to just stuff it down, it gets pushed down into the unconscious, and that thought tends to turn into a feeling. We call that process of pushing a thought or something hard that we're going through down into our unconscious, we call that repression. And when that happens, it generates these feelings that just linger for long periods of time in the unconscious. These feelings might be things like anger or frustration, fear, anxiousness or sadness, grief. Any negative emotion that goes unaddressed just lingers here in the unconscious. And while those emotions are lingering there, they can have an effect on any of these body systems. So let's say, for example, a child is chronically anxious or worried. Well, maybe they tend to have an upset stomach. Or let's say a big CEO tends to be very stressed or gets angry, and maybe he has heart problems or high blood pressure. Or someone that is going through a really stressful time, maybe they have increased muscle tone. We've all had where you have a stressful day at work and you may feel a headache, or you may feel tension in your neck and shoulders. That can all be driven by stress causing the muscles to tighten up. Or maybe you have pain going down your leg like sciatica, and you may think, well, I have sciatica because I have a disc herniation. Well, I had a patient like this. Let me pause to tell you about this. And his job is he had to work at a factory supervising all the parts and pieces and machinery being made. And his leg was hurting so bad from sciatica that he couldn't even walk the length of the factory. He'd have to sit down for relief. Well, he went through pain management, and the pain management doctor told him, well, you have a disc herniation, you have stenosis, and you have degenerative discs, and all those things are pushing on your nerve, causing your leg to hurt. Well, he went through all the pain management. It didn't help, so surgery was his next stop. But before he went there, he came to see me in physical therapy. And I asked him about his life and treated him a few times. And by the third time, I convinced him, I want you to pursue this pain reprocessing therapy. I gave him some reading material, and he read the reading material over a weekend. Well, he came back to see me the next week, and he said, I'm completely better. I said, really? What was it? And he said, well, I read the material you gave me. He said, I had no idea how much stress and anger and guilt I was carrying from my divorce that happened 2 years ago. And that's exactly when his pain had started. That started 2 years ago. And he had no idea how much anger and guilt he was carrying that was causing his leg to hurt. And his leg pain got completely better. He was able to walk the length of the factory and bend and twist without any pain. And we concluded therapy, and 2 years after that, I followed up with him, and he said, I'm still doing great. And so that's typically what I see with my patients, is those that are willing to go through this process, they experience permanent lasting relief. So back to what we're talking about, these emotions get repressed, and they can cause dysfunction in some of the body systems. And so how do you make this so that our feelings like anxiousness or fear or guilt or anger, it doesn't turn into increased muscle tone, or doesn't feel like a pinched nerve, or doesn't cause our back to hurt? Well, it's through this process over here. So all these emotions got into the unconscious, where they can have an effect on the body through repression. So we get them out of the unconscious through the opposite of repression, which is expression. And this is actually quite easy to do. We can do that through writing or through talking. So instead of taking our emotions and stuffing them down and just pretending like everything's fine when actually it's not, maybe we write about it. And we say, well, this experience has been really stressful, or I feel really worried about this. And in that way, those emotions can never turn in to physical symptoms, but instead they get expressed where we are aware of those emotions, and they become thoughts again, and they don't have an effect on the system. So when emotions get stuffed down into the unconscious, they can cause issues in our physical body, but if they get expressed, then we relieve ourselves of those negative emotions and reduce the chances of them turning into physical symptoms. I'm going to give you another example, okay? I had a patient that came to see me, and she was having horrible neck pain. I said, what happened? And she said, well, I went out to my yard to mow the lawn and I had to move some bricks first and my neck started hurting. So she was, of course, blaming her neck pain on having to lift some bricks. Well, I treated her a couple of times and I taught her about this approach and she said, you know, that day that I was lifting those bricks, I went outside to mow the lawn to get away from my husband because he was bothering me. He was talking about something I didn't want to talk about. And I told her, I said, well, that could be causing this pain that you're having. And so she went home. She did this on her own without me telling her to. And she had a talk with her husband and said, this is the way it's going to be going forward. We're not going to talk about that. What he was talking about was he had lost his brother. His brother had passed away, and he wanted to talk to her about it to where it was months past the event, but it was really hard for her to just have to be around that all the time. So she had a talk with him, and he ended up stopping talking about the brother. She came back, and her neck pain completely went away. So she was able to actually express it to where it wasn't causing the neck pain to occur anymore. So oftentimes with my patients, as we do the physical therapy, we'll get them to start doing some journaling, start doing some education, learning about this process, this pain reprocessing therapy. And typically what we see is symptoms start to reduce, sometimes quite drastically. Sometimes it takes a period of weeks or sometimes months, but usually a period of days or weeks. And their symptoms start to improve and they get completely better. The great thing about this is they tend to stay completely better. So you may have been diagnosed with, say, a disc herniation or stenosis or some physical structural thing that showed up on MRI. Maybe it's arthritis. And I have found in my experience with my patients that the structural diagnosis doesn't really matter. Now, if it's a tumor growing or a fracture in a bone or a torn tendon or ligament, that's a little bit different. But if it's just kind of these degenerative issues like arthritis or stenosis or disc degeneration or disc herniation, those issues tend to work very well with this pain reprocessing therapy. So if you'd like to learn more about this or like to see what we can do for you, don't hesitate to come by and visit with me, Spencer McCombs at McCombs & Associates Physical Therapy. Thanks so much. Bye.